Hello, well, thanks for having me in for a visit today. And we're going to talk about a couple of issues that I think is really important to us in the community, but more widely, of course, the NHS as well. But I just thought we'd come in, have a chat, and I'm going to probably learn some things which I can take away. So thank you. So I'm Martin Goss. I'm local councillor, and also I'm the parliamentary candidate for the Lib Dems, and I have been visiting Stephen for many years, but if you'd like to introduce yourselves, and we'll go from there.
Yeah, I'm Stephen Pitt. I'm the practice owner of Dental Hygienists. We opened in 2005, so just under 20 years have been open. And we linked up with the University of Essex, probably about 15 years ago.
Yeah.
Because we like the idea of teaching students within the community and what it brings. But I'll just introduce you to...
Hi, my name's Amalia. I'm head of the Oral Health Division at the University of Essex, and that's what I do.
Excellent. Excellent. Well, I'm really pleased to say that I've personally experienced using students for many years because I've got quite a complex dental history, as Stephen knows, and therefore I have to visit the hygienists quite often. So I think it's really good because I feel I'm putting something back into the local community by helping the students have real practice of quite a complex mouth, which is what they have to clean. So, can you just tell me what you get from the students in terms of feedback and how it helps them, how it helps the university?
Yeah, I think what's fantastic is the partnerships that we create within our community, and our community is quite wide. It's all over the east of England and beyond, sometimes nationally. And I think what the students get out of it is that real world experience by working in local dental practices, meeting their community as well, and engaging with real patients in real life scenarios. I think it's fantastic overall, and the university benefits for that, because we see and meet our community, and the students bring that back in, and then we have discussions about that.
That's
in the lecture room.
And it's absolutely much more than just a textbook case of people learning. It's real life, real patients, real complexity, and real diversity. So Stephen, you've obviously been involved in the university for about 15 years. What's the impact for you as a dentist and for the students? What's your sort of view on it?
Yeah, I think it's really sort of helped out. The big difference to University of Essex to other universities is they are, as you say, treating a local community, a broad range of people, not just specialist people that are referred into a hospital. So, they're seeing what they would see when they're qualified. So how it's helped from our perspective is because the students get more time with the patient, we feel that we've really been able over the years to really educate our patients to help prevent problems. And I mean, I may digress into sort of the NHS and things and some of the problems there, but I think the big issue with any health issue is a lot of the time some people focus so much on the symptoms or the problem rather than the cause. And I think that's key to any healthcare, isn't it? Is prevent the problem before the problem gets there. And by this kind of partnership, we're able to give a lot of information to our patients on a regular basis to reinforce that, to help prevent those bigger problems happening.
Yeah, no, I think that's really good advice. And in terms of the university, I know they've had a long history with the dental studio in Colchester. Do you have many other practices that you managed to place students with on longer placements?
So we've got probably about 30 or 40 placements that we work with, or 30, 40 practices, dental practices. And again, mostly in this region, but also beyond. So we definitely have a very good feel of what's happening in local dental practices. We have the partnership is so great that we can have lots of conversations about how the political environment affects them, about how their day-to-day running of their practices changes and how that impacts on student and education provision when those changes happen. And that's an ongoing challenge, I suppose, that we've had.
And when I look back to when I had original orthodontic treatment done in the 1980s compared to what I've had more in recent years, and the real importance of the hygienists because they weren't really recognised back in the 1980s. How is technology impacting kind of what you're doing? Because it always feels as though the industry is innovating all the time. And I just wondered, do you see a lot of changes in that 15 years? And do you see more changes coming sort of down the line for dental hygiene and dental care?
Do you want me to answer that? Yeah, I mean, I think that the big changes in recent years have been more kind of the digital element of it.
Right.
So we're moving away from the traditional ways of taking molds of people's teeth to more of a process of 3D scanning the teeth. That information instantly goes to the laboratory. From an environmental perspective, we're not then using materials and waste them because what used to happen, you used to take a mold of something that used to be cast up, that bit used to be thrown away. If it wasn't cast up properly, that was remade. Then something was made on that casting, and then you've got stone or plaster that you need to dispose of as well. Whereas now, a lot of the work is done on a computer. If they need a small element of it done, it can be kind of 3D printed out. And we're using that information as well by doing scans of regular checkup that we can monitor things more regularly. What we're seeing is changing from a population perspective. It's not just sort of tooth decay and periodontal disease. It's what we call tooth surface loss, where people, I've seen a lot more after COVID, people are a lot more stressed. And, the cost of living isn't just affecting the way their households live, it's affecting their teeth because when people are stressed, they clench. And when you clench, you put 10 times more pressure on your teeth. So we're seeing a lot more kind of breakages of teeth or teeth just wearing down. So we need a process of kind of monitoring that more closely.
That's really good to hear. And having been through that process over the years from the 1980s, when you used to get that horrible pink gunk put into a plate and into your mouth, it's quite difficult and quite hard sometimes for some people to breathe. And that sounds fantastic. That really does sound like a step forwards, which removes that. Much better for the environment and much better for the patient and longer term health improvements potentially by catching stuff early. What you can do to build up people's teeth as well to ensure that they keep their teeth, which is fantastic. A big thing that comes up is the NHS. Now, you, in the start of your career, at the beginning of your career, you absolutely were involved in the NHS and you were very passionate about it. And regrettably, you, like thousands of dentists across the UK, have had to come out of the NHS. What is it that's wrong with the NHS that has forced dentists to pull out of NHS provision?
It's the way they changed the contract. I mean, when I first qualified, we worked on the basis that you were paid for what you did. Rightly, wrongly, worked well. Like anything, some people may have abused the system. But, with any industry, people always point to the negatives, and the majority of people work fine. So it was changed in a way to, from a patient perspective, put it in kind of 3 price bands. But what it ended up doing is meaning that if you did 1 fill-in, you got paid the same amount as if you got 20 fill-ins. So what it then meant is you had practices maybe just keeping hold of their practices and being scared to take on new patients because they might bring a whole heap of problems. And then I was working under this new system for many years, but they never increased my banding, my money. So we, you go 10, 15 years on that, if you're paying the same as you were paid 10 years ago, you start making more and more of the loss.
Absolutely understand that, and that's clearly why dentists have had to vote with their feet to actually withdraw from the scheme, particularly if it's not increased for 10 or 15 years, where we've had a cost of living crisis in recent years, inflation, salaries go up, electricity goes up, etc. It certainly hit home to me when I saw a programme that was Tonight did a documentary on pharmacies closing. And the NHS is doing the same there, where a pharmacist might be paying £6 for a certain drug. There's a book price that the NHS pays back to that pharmacist, and it might be £4.50, which means on that transaction, that pharmacist has just lost £1.50. Now, that's why pharmacies are closing. And what worries me is if the NHS doesn't reform dental contracts and also for drugs, because clearly you need to administer drugs in certain cases to patients, it's going to have a further impact on pharmacies, and what little NHS provision is left will completely disappear. So I think one of the things that certainly Liberal Democrats have said is we want to reform that contract so it pays fairly. And I think that dentists would embrace that to come back into the system, but it has to be fair. It has to be fair. The problem, my worry, is the system has gone too far, and it's going to take many years to get dentists back onto the books and to deal with some of those issues, particularly around child dental provision, because there is little capacity. So sort of closing thoughts, do you absolutely support complete reform of the NHS contract?
Yeah, we do.
Yes.
And I think there has to be sort of a strong emphasis on prevention as well.
Absolutely.
And it's, people need access, and especially sort of patients that are in severe pain and emergencies.
Absolutely.
Because that is tying up A&E's time, tying up out-of-hours doctors' time.
Yeah.
So, one area has a big impact on the whole kind of healthcare service.
Yeah.
And if someone's got dental pain, it's taking them out of work.
Yeah. Yeah, no, absolutely. In fact, what you just described is further pressure on the NHS when actually it should be the dental professionals that are dealing with it, and of course coming back to the hygienists to ensure that they're looking after people and that there's cost-effective preventative measures there. So that's been really insightful. Thank you both for your time today. I realise you're both very busy. Thank you for what you're doing. Thank you for the students, what they're doing to try and keep our teeth in good shape. So thank you.
Thank you.
Thank you.